The Dentalpreneur Podcast. Okay, doctor, it's time to put down that handpiece. You're listening to the show dedicated to helping dentists get their lives back. It's time to decrease your stress, increase your profitability, and regain your passion. Now introducing your host, Dr. Mark Costas.
Hello, everyone, and welcome to another episode of the Dentalpreneur Podcast. I'm your host, Dr. Mark Costas. What's up, my friends? I hope you're doing great out there today. I'm super excited to be welcoming a repeat guest back to the podcast. And wow, in the pre-chat, we were just chatting about all the things that are happening in her life right now and her new business or her an evolution of her business. So I'm super excited to dig in and learn more. This is Dr. Jessica Metcalfe, and she is a strategic leadership and workplace culture consultant with a focus on professional and personal development. She is a former dental oncologist and education director at one of the top 5 cancer centers in the world. Jessica started out by teaching the medical and dental community how to improve a patient's quality of life post-cancer therapy, and now helps high achievers and teams improve their quality of life, preventing burnout and navigating imposter syndrome, perfectionism, and people pleasing. Holy cow, is that something that is very, very necessary in our world today? Welcome to the podcast, Jessica. How you doing?
Thanks so much for having me. I'm really excited to be here.
Yeah, yes. Where are you located, Jessica?
I am on Vancouver Island in British Columbia.
Awesome. So, oh my gosh, we were talking off air before, and I was just kind of caught up on all the cool things that are happening with you. And you recently released a book in November of 2022 called Speak Kindly, You're Listening. I want to dig into that. But maybe you could just take a moment to give us a little bit of history. Let's hear about your origin story, how you got into the world of dental oncology. I think it's just a fascinating backstory. And then I would love to dig deep into your most recent project, which is your book.
Yeah, so dental oncology, I never would have expected that I ended up in dental oncology at all.
Yeah.
So I had returned to where my family lives in Toronto, Ontario to complete a hospital residency program.
Okay.
And there was always a love around medically compromised patients because I really appreciate the problem solving and having to think outside the box and just think very differently. And during that time, I applied to oral surgery 2 years in a row, didn't get in. And at that exact same time, I had stayed on where I had done my residency program as a staff dentist part-time while I was in private practice.
Okay.
And around the exact same time that I got my second rejection, the neighboring hospital, which was Princess Margaret Cancer Center, reached out to me and said, "We know you're devastated right now, but we would like to offer you a full-time position over at the cancer center." Now, I had rotated through a part of my residency, and so they knew who I was. And I sat down with one of my coworkers at the time before she became a coworker. Mm-hmm. And I said, "Listen, what are your thoughts on this? Should I reapply to oral surgery? What should I consider?" And she's just like, "Honestly, this is going to give you everything that you want out of oral surgery, which is that complexity aspect of it." And so I stepped into that role, then became an education director, was acting deputy chief of dentistry for a period of time as well.
Wow.
And it was everything that I absolutely dreamed of, being able to think differently, have a different perspective, step outside the box. And my goal, once I was in the thick of everything, was to be able to then teach others how to improve a patient's quality of life post-cancer therapy. Because at times, there is so much prep work that goes into getting a patient ready for their treatment. Mm-hmm. But then afterwards, there's a drop-off, and that goes from clinician to patient as well. It's because, okay, well, I'm in Survivor, and I'm done. Essentially, I never want to be back at the hospital again.
Yeah.
But now we have the family physician and the family dentist and what that actually means, because long-term side effects and managing that is actually part of palliative care. Even if you're in survivorship, you can still have palliative care. And that's where dentists come into their role and what that means from a long-term perspective. But when we think of palliative care, we always think end of life.
Yeah, for sure.
And so that's when I started to step in. I was like, okay, next goal is to be able to then teach the dental community, to be able to step in, feel comfortable treating these patients. So then that way they knew exactly what their role was.
Yeah. Wow. That's so powerful. So when was it that you decided to kind of evolve away from that role and from that full-time kind of position and what you were doing and working with palliative care and physicians and survivorship and all that stuff? What a great calling. Amazing that you just kind of stumbled into it, right? And then you decided that it was time to kind of transition?
So it's funny because when I go look back, I didn't realize how I was kind of sprinkling in things along the way without even realizing it. So when I was at the hospital and was full-time there, and I had been about 2 to 3 years in at this point in time, I then received my own diagnosis of clinical depression, a generalized anxiety disorder, and what I now know to be as my third burnout. And at that point, here I was taking care of these patients, trying to teach dentists and the medical community, and yet I totally stopped and forgot to take care of myself, essentially. And so I started with that process of, okay, what does this actually mean? What does that look like? And being that high achiever, being that perfectionist, and I like to call myself a recovering perfectionist at this point in time, is the fact that I pushed myself so hard that I essentially stumbled into that aspect of depression, anxiety, and burnout. Now, being at the research center and me always thinking outside the box and wanting to find a different perspective, it was really natural for me to, okay, along my journey, why are we experiencing what we experience as high achievers? Especially since we know dentists still have one of the highest suicide rates. So we're still considered top 3. So once I started to navigate what I was experiencing, I slowly started to share it with others, and other people were confirming that, oh, it's not just me. Yes, I'm experiencing this too. So when I started lecturing on improving patients' quality of life, there's an emotional commitment there when you're treating a cancer patient. And sometimes when you leave that aspect, that emotional connection still comes with you. And now that's a lot of heavy emotions. Yeah. Well, within dentistry as a whole, I started to sprinkle in ways into my lectures for the clinician to be able to take care of themselves. And when more people started to reach out to me, I then was like, okay, I can't just teach a clinical lecture anymore. I want to be able to teach about burnout and self-discovery and self-compassion and imposter syndrome and all the things, especially as a high achiever perfectionist starts to experience. And when I started to lecture on that, the next transition was super easy for me to then write a book about it. So then it became accessible to more people. Now, when I started speaking on the topic initially, I then had other people outside of healthcare reach out to me, found me as a speaker and said, hey, can you come and speak to our teams? Hey, can you come and speak to our organizations? And so it just kind of slowly started to evolve over time. And I realized I didn't just want to help the healthcare sector. I wanted to be able to help other businesses be able to thrive as well.
Wow. What a cool journey. What a cool journey. So what percentage of your clients or people that you work with are in healthcare versus small businesses that are outside of healthcare?
So it's about a 50-50 split now.
Wow.
Where I still I'm not promoting within healthcare anymore. It's more so names kind of out there, and then people will essentially find me. My goal is to be able to really change the dynamic of the way that we work at this point. And so when I was in my own deep, dark abyss, one of the things that kept coming up was I kept wishing away the next 25, 30 years of my career. I just needed to make it to retirement. And so I hustled like you wouldn't believe. I was working 6-7 days a week. I was like, if I can retire early, then I'll be happy and then I'll feel successful. And it's not an if this, then I'll be happy, because I needed to be happy now. Working at the cancer center, I'm so appreciative of my patients because it also finally hit me like smack dab in the face one day where I was like, not everyone makes it to retirement. And so that gave me the opportunity to start to reflect on, okay, what is happening? Then COVID hit and we had the Great Resignation and people started to reevaluate their jobs, both within healthcare, because physicians have even started to decrease the amount of clinical days. We're seeing it within dentistry as well. And when we start to take a look at it, especially when we are leaving either a toxic workplace culture or something that no longer worked for us, if we don't do the introspection first, we'll go to the next job. And this is what happened with the Great Resignation, which then turned into the Great Regret, is those first 4 to 6 months, we experience that honeymoon phase at that next job or the next thing, whether it's a hobby or something that we're doing. But we didn't do the introspection and we didn't actually figure out, okay, what wasn't working previously. And what ends up happening then is we automatically assume, well, any now position that I get into, anything that I try, it's never going to work. It's never going to make me happy. So if we can understand why we're experiencing what's happening and then where we want to be in the next 5 to 10 years, we can start to reverse engineer that and be able to get us there. But that impact is largely correlated with workplace culture and how you choose to show up. And that then involves more people. That's not just you. And so my goal is now to be able to help with improving both from a business standpoint and a personal standpoint on leadership skills and aligning that workplace culture, because you spend an enormous amount of time at work. You do not want to be hating going into work or dreading going in, or the Sunday scaries where now all of a sudden your anxiety peaks, or you go on that vacation, you come back and 2 days in, you're hiding yourself in the closet crying because now the vacation was a waste and you shouldn't have even left to begin with. We don't have to live like that. And there's ways to start to make those changes.
Powerful stuff. So a couple of questions, just out of curiosity. I had always heard, and for a while I thought that it was an urban legend that you know, dentists had a very high suicide rate. A lot of people said it was the highest suicide rate for a period of time. I did my own research because I used it in one of my talks, and it turns out from my research, we're more than 2 times as likely as the average human to commit suicide, and that's affiliated with our profession in some way or another. Do you know what the first 2 are? If we're number 3, what are the first 2?
So veterinarians and family physicians. And when we pay attention, so when they tend to do research based on burnout rates, they're also lumping certain professions together. So the stat that you just described is from an overall human perspective. One, when they're looking at top 3, it might be white collar professions, because then when you look at blue collar, there's specifically within that higher suicide rates in certain trades. And so we're seeing these numbers just peak and stay consistent, especially in certain professions. And so if we know that that exists and we know that it's happening, because I even remember I decided I wanted to be a dentist at the age of 14. And I remember when I would tell people, they would even say, don't dentists have one of the highest suicide rates? So that's been happening for decades.
It has,
right? So we know this exists, and I think we're having more open conversations about it. It's just, we need to make sure, A, we're taking care of each other. And the second is recognizing it's okay to ask for help. And I think we're in an era of generational dispute around the dentists who are of the boomers age at times, the Gen X, and then the millennials of no one wants to work. And it's just because dentistry and working and hustling just looks different now compared to previously. Not saying that it's necessarily harder, it's just that it's different. And with those different challenges, it gives people the opportunity to say, okay, but with those challenges, how do I want to live my lifestyle? One of the reasons why we choose dentistry is because of the lifestyle that we hope we're going to achieve with it.
Right.
So now it's asking ourselves, how do we fit work into life, not life into work?
Yep. not to get too overly personal, but I would love to hear your reflection on why you think you went into that dark place and why you became, was it clinically depressed at that period of time? Was it directly related? I know that the multifactorial reasons that people experience depression, but for you personally, did it have to do with, compassion fatigue, or was it something to do with, the fact that you were just completely so burnt out on what you were doing that you couldn't see a brighter future? What was it for you personally?
So I appreciate when you say multifactorial, because a lot of people will automatically assume that it's one thing. And so you try to go back, you try to look at it and it's like, what is that one thing that set me off? And it's not one thing that sets you off. It's a bunch of cumulative factors and our own behaviors that contribute to it. So part of what contributed to it is my perfectionist behaviors and tendencies and pushing myself to a certain point and realizing that now looking back, there is no such thing as perfection. You can aim for excellence, but there has to be a boundary in place that you give yourself permission to then build self-compassion. Around the exact same time, my mom's bipolar and has been bipolar my entire life. And she has had multiple brain injuries, and a part of that she developed psychosis at times. And so I had stepped in as that caregiver role and has been a caregiver since I was a teen. And that amplified once I moved back from Boston, which is where I graduated dental school, to Toronto. So I had that additional role. I people pleased like you wouldn't believe. So I said yes to way too many things. And then because of all of these things that were happening, I just didn't see a light at the end of the tunnel anymore. And I did start wishing away those 25, 30 years because I just needed to get past this point, because then there was the hope that happiness would be on the opposite side and that everything that I had finally worked for would have paid off. So initially, when I reflect back, I had gone through and I checked all the boxes. And to me, checking those boxes should have meant that it brought me my success and it brought me my happiness. But I spread myself too thin. I sat on local committees all the way to national committees. When people would ask me, oh, what do you do outside of dentistry? I would just say I did more dentistry. So dentistry was my entire life. And then when I wasn't doing dentistry, I still was taking care of others. And because of that, I would see people who would implement boundaries and I would become cynical and angry towards them, being like, who do they think they are? They can take off a Friday. It's like, well, now I'm here and I have to work because I have to do this. And I didn't have to do anything. It was the pressure that I had put on myself. And I didn't see it as depression until my psychiatrist had picked it up. And I'm so grateful for it, because I was actually attending my mom's psychiatrist appointment and I had broken down in that visit, and he had said, I think you need to start seeing me on your own. I think you have depression. Now, because I grew up with a mom who was bipolar, to me, I thought I knew what depression looked like. It was sitting on the couch and not getting out of your pajamas and not taking a shower. And there was this, and yet there was me who was highly functional going through, I was treating patients, I was doing all the things. So to me, it didn't make sense, but it also didn't make sense that I also wasn't thriving. And there was this aspect of, at the end of the day, I'd come home, I didn't want to see anyone. I didn't want to talk to anyone. I know at one point showers, like the water from the shower felt like knives on my skin. Oh. Like those should have all been indications to me, because I isolated myself. Except to me, I was just like, well, I'm doing dentistry. I'm doing all the things. And so I'm so grateful for my psychiatrist, because he's like, okay, let's start to work through this. And when I gave myself the permission to not only ask for help, but take time for me, that's when I truly started to accept, okay, this can't work for the next 20, 25 years. So if it can't work, I then don't want it to work. What do I want it to look like? And it was the first time in over a decade where I actually gave myself the permission to be like, okay, what do I actually want my life to look like? And how do I work towards getting there?
I think it's so powerful that you talk about this desire back then to fast forward 25 years to get to the end of it's so well put, because I know what that feels like. You know, when you hit burnout and you hit this distressed point where you don't think you can go anymore. And I called it the Sunday dread. Like I would be watching football and cheering for my favorite team and having fun with my family. And then about 11 o'clock or 11:30 or noon on a Sunday, I would just get this pit in my stomach. Like, I have to go do it all over again. Like Monday was the worst day ever. Do you think it's interesting because you call yourself a recovering perfectionist, obviously type A, obviously very, very high achiever, like all of those things, check, check, check. Do you think that it's causation or correlation? Because dentists are high achievers. They're perfectionists. They're hard drivers. So do you think that it is because of our personality traits and not maybe the profession that leads to this higher likelihood of burnout and depression and suicide? I don't know. I'm just asking a personal question. I don't know.
I love this question because I have stumbled down that research rabbit hole of, okay, is it this or is it that, or what's the kind of the combination? And so when we look at pre-dental school, there's a set of individuals, really high DAT scores, high GPAs to begin with. So you're already leveling up and you're kind of the golden star in your class. So that bar is already set high to begin with.
Yeah.
Okay. Now you already have part of those personality traits that have been a part of you because of childhood as well. And so what got taught early on based on experiences could be trauma as well. And so we take those behaviors with us. Okay, so now you're that golden star and you get into dental school. Well, now you're amongst all the golden stars. So now you got to raise that bar even more. So when we're raising that bar and we keep raising it, the expectation as that high achievers, we're just going to keep on raising it. Now, when we're amongst individuals that are consistently raising the bar and we don't give ourselves a break, we don't give ourselves the opportunity to build self-compassion, to take time off when we're sick, then we get stuck thinking that we're never good enough. And this comes back to why I essentially started to write a book about our inner voice, is because that inner voice gets carried with us our entire life. So if we're just tearing ourselves down while we're amongst and the bar has been raised and we don't see that the bar has been raised because it's just so natural for us as that high achiever to get to that next step, just to keep on moving, then that we take with us into every aspect of our life. That includes our personal life, with our family, with our kids, with our partners. And I don't think it's an either or. I think it's our life experiences that get compounded over time, and then who we decide to surround ourselves with. And social media doesn't help at this point because the algorithms push out what you see. So if your account, and this is actually something that I teach, if you have an account and your entire account you follow are other dental accounts, that's all you're going to see. So if you consistently compare yourself to the perfection in that photo, because it's a one-time snapshot and people choose and curate what those photos are, then of course you're always going to feel less than. If you're someone who has a passion for cooking and you follow a whole bunch of cooking, then you're going to see less dentistry and you'll see a lot more cooking. So if we pay attention to the algorithms and what we choose to see as well, that also will impact our own mental health and how we see ourselves in relation to the world.
Yeah, I think that you can expand that like infinitely, right? Social media wise. And I love that one of your talking points is imposter syndrome, because so many of us feel inferior to what comes through our feed. And you're talking about from like a financial and wealth perspective, from, you know, a body image perspective, from, I mean, like how nice their complexion is perspective, and like how far they've been able to, you know, progress in their career in a certain period of time. So, you know, we are every day constantly comparing their highlight reel with our everyday. So of course that's going to have a negative effect on our psyche when you're bombarding yourself with that constantly over and over again. And I think it's interesting, the whole idea of imposter syndrome is something that a lot of times we do to ourselves, right? That we are the ones that are telling ourselves that we're not worthy of saying something or doing something or pursuing a particular goal. And a lot of times it's secondary to something that's not real, that we're comparing ourselves to. I would love it. This is difficult to make a segue into this from what we're talking about now, because I could talk about the burnout stuff and, the depression stuff for a really long time. And I want to give it lots and lots of attention and time. But there's so many other things I want to talk to you about. So let's talk about that imposter syndrome, that perfectionism and burnout. Like, how can we navigate through that as somebody that's come through that on the other side? I am really fortunate in that I get to speak to hundreds of dentists every single month. That is a recurring theme. Maybe the most recurring theme is, I'm exhausted. I hate Sundays. I don't want to do this anymore. How were you able to retire at such a young age from clinical dentistry, Mark? I want to follow that path. That is a disturbing trend from the people that I talk to. It's the vast majority of people are saying the same things.
Mm-hmm. So this is really interesting, because I think that this is where the older generation comes in and says, well, why can't you suck it up? Like, I still know of certain individuals who are close to their 70s who are still doing clinical dentistry. Yeah. And which is fascinating, because you have a couple different ways where some people, again, chose dentistry, are able to work that length of time because they were able to balance their lifestyle. So what do I mean by this? I know a dentist who essentially built his clinical days around being able to ski. So he lives close to a ski mountain. And so that was a priority. He fit work into life. So of course there's that sustainability, because right off the bat, your priority is still you. Mm-hmm. Then you have a different set of individuals who practice dentistry, never picked up any other hobbies. And so now they're going to get to retirement and they're going to think, well, what the heck do I do with my time? Yeah. Because they never picked up anything else. And that is a common trend. And there was actually a paper that came out around firefighters, which is when they retire, they are actually soon thereafter to develop cardiovascular illness, a heart attack or a stroke, and die soon after they actually retire, because they've lived at such a heightened level for so long. Wow. So you have to give yourself the permission to build all those hobbies along the way. So going back to the exhaustion, when I was piecing everything together on how imposter syndrome, perfectionism, and burnout came together, it all came back to our inner voice and the permission that we choose to give ourselves and how we choose to speak to ourselves and tear ourselves down. So imposter syndrome is self-doubt coupled with the feeling that you're going to be found out. So you explain away your successes, you overwork to the point of exhaustion, you underestimate your abilities, you're consistently questioning your worth. Yeah. Now, part of imposter syndrome, though, is perfectionist tendencies, because that drive for perfection means that, okay, well, I'm going to be able to achieve something if I exhibit these perfectionist behaviors, like excessive checking or redoing or going over things multiple times and not being... So there's a lack of trust when it comes to yourself, but that lack of trust also comes from a lack of confidence in yourself. Mm-hmm. Now, if we look at burnout, there's 3 pillars within burnout. There's exhaustion, which can include emotional, physical, mental, and spiritual exhaustion. Then there's cynicism and negativity towards others. And in that one is self-compassion or compassion fatigue. And then the last aspect is the lack of confidence. And so you have a decrease in productivity. And I'm not talking about numbers. I'm talking about it's hard to get going and stay going because you just don't have the confidence in yourself. So even you could be standing in the grocery store, and because you're so exhausted, there's too many choices, you have decision fatigue, and now you leave there being like, I couldn't even make a decision about the ketchup that I wanted to pick up. Yeah. So, right? And so when we start to look at it and see how things come together, the way that I like to do it is to start to create checkpoints. And one of the easiest ways to be able to step in to starting to understand the cycle that we've gotten ourselves trapped in is starting to build up our confidence first. Because when we start to build up our confidence, We start to trust ourselves. We then start to reset our expectations around perfectionist behaviors and tendencies and expectations. We give ourselves the permission to implement boundaries, which now means we give ourselves the permission to take rest, and we get to redefine what productivity actually means. So when you start to navigate burnout and imposter syndrome and perfectionism, a lot of the research that's out there, because there hasn't been enough around longevity on recovery, but what I've narrowed it down is that recovery can take 1 to 4 years to recover from burnout. Why?
Wow.
Because it's an entire lifestyle change. Because what wasn't working anymore needs to be taken apart and evaluated. So the number of days that you choose to work, the types of procedures you want to do, where do you want to spend your time when you're not in clinic? Do you want to expand your family? Do you want to travel? What is important to you? What's your definition of happiness? And when we're in the thick of everything, we automatically assume that productivity is linked to clinical work. And so if we're not doing clinical work, then we're not productive. And why even go in? And now a patient cancels and we have holes in our day. And oh my goodness, this is a waste of time. So we have to change our perspective on what productivity means. For example, sleep. Sleep is just as important to us, and it can affect our mental and our physical health. And we have to make it a priority. That has to be redefined to us as being productive. That also means redefining what rest means to you. If that means then you're going to grab a book and you're going to sit on the couch for 3 hours, you're allowed to do that. It doesn't mean that you have to be grocery store, take the kids here, do that, and you go through that checklist on the weekend and then you're exhausted and then you just go back to your other job come Monday.
That's true.
So we have to give ourselves that permission to evaluate what is the lifestyle that we're working towards. And as we slowly start to chip away at it, then we get to understand, well, why am I exhausted? Am I giving too much away? Am I saying yes to too many patients when you're allowed to fire patients? And I don't think people realize that, because that perfectionist tendency is that, well, we need to make time for everyone. We need to treat everyone. If Tuesday comes along and you just happen to look ahead at the schedule for the next week and someone in your schedule is there and you're already dreading that appointment and it has an effect on the rest of your team, then that patient needs to be let go. And we have to give ourselves the permission to actually step into the uncomfort of resting, of letting patients go, of saying no, implementing those boundaries and what they look to us. And so something I want to touch on really quickly are boundaries. And so we can have physical boundaries and we can have psychological boundaries. And what that means is the line that you draw in the stand to separate you from whatever that thing is. A psychological boundary could be how you choose to leave work at work. So let's say you get to the end of the day, you're writing your chart notes, you're still in your scrubs. A mental psychological boundary could be as soon as you get out of your scrubs and you close that door at the office, you're done. That's it. It may mean then when you drop your keys, let's say you hang your keys up or you toss them in a basket when you get home, the actual act of dropping the keys could be that psychological boundary indicating to you. Now, when you do it, you have to remind yourself, because it has to be conscious, saying, I'm done. I'm done for the day. That is that boundary that you're implementing for you. The more that you do it, it then becomes subconscious and then you don't think of it because now it's just a daily habit. But you have to create those boundaries and you have to give yourself the permission to stick to it.
So good. So much wisdom in all of that. I love the boundaries part. I think that, oh man, dentistry is difficult in that it's difficult to get an objective measure for a lot of the things that we do throughout the day outside of production. Production's so easy to measure.
Yeah.
It's the easiest measuring stick, right? And depending on the type of practice that you have, this whole hustle culture, online as well, like in the socials, this hustle culture, like you got to work your face off. You got to go 7 days a week. You got to work 15 hours. And to your point, like the previous generation, my generation, even, I've been doing this for 21 years. My generation's like, just work through it, suck it up. Of course your back is going to be sore. you're seeing one patient every 2 hours. I see 8 patients every 2 hours. And it turns into this like one-upsmanship. And I see that generational difference. What I will say though, that back to my analogy about this measuring stick, production is so easy to measure. And there's so many other subjective things that are difficult to measure. And that goes to kind of culture and leadership. Subjective things, difficult to measure, right? I'm becoming a better leader. Well, I could just measure my production over the trailing 90 days. That's easier to measure than my increase in effectiveness as a leader, right? So I think the trap that so many of us fall into as dentists is that, oh man, that daily production goal, it's so easy to measure. I know exactly how to reverse engineer that. In this type of practice, what I'm going to have to do is see 1 more patient per hour and 2 more hygiene checks per hour, and I will hit that number. Yeah. Inadvertently, what we're doing is we're hitting this objective goal, but there's so many subjective, things that happen as in response to that can often be negative, and the cumulative effect happens very quickly, faster than people think that they will, that things will happen. So you're doing this with your production, you're going, up and to the right with your production, but a lot of things are falling apart at the same time. And we're becoming burnt out. We're becoming physically, emotionally, mentally fatigued. And I just see it happen to so many of my colleagues, and it's happened to me personally as well. I had one singular goal, and that was a production goal. That was a personal income goal. And as you're charging through that, you're looking for happiness and fulfillment. But when you actually get there, many times that adds to the distress because it doesn't lead to happiness and fulfillment when you actually hit that arbitrary goal. So talk to us about, this is my attempt at a segue because there's so many different things to talk to you about. Talk to us about how we can become more effective leaders, and how we can integrate our core values and improve our culture within our organization, whether or not you're a dentist listening, or a veterinarian, or a family physician, or a small business owner, which you're working with a lot now. And thank you for the insight on the white collar kind of hierarchy of distress and suicide and stuff like that. It's really, really sad.
It's sad because of the fact that you have these individuals who got into these professions to truly help others. And along the way, whether it was a part of fear-based or shame-based learning, or someone at some point said to them, suck it up, and they just happened to be talking to the wrong person at the wrong time. And like, these all contribute to how someone views themselves. And if they don't give themselves the permission to start to view themselves in a different way, then it's harder to be able to step into those goals and those production points and understanding what happiness is along the way. It's really fascinating because when we set those goals, exactly how you said, it's really easy to look at production and then decide, okay, 2 more hygiene checks, 1 more patient, whatever that looks like. Okay. You get to and you reach that goal. Is it sustainable? And I think that that's what we need to give ourselves the permission to ask, is then looking back. Don't just look at the number. Go look back at those days. How did you feel at the end of that day when you saw those 2 extra hygiene checks and you saw that additional patient? Was it something that gave you the energy at the end of the day, and you went home and you went to your kid's soccer game and you were super happy to be there? Or at the end of the day, were you absolutely depleted, or that Sunday dread comes along and you're like, oh man, I got to fit in those 2 extra hygiene checks to be able to make that number.
Yep.
So when we look at production, and this happens with workplace culture, we've been conditioned to only be able to look at those specific numbers. We can look and analyze qualitatively as well, which means that we're not just looking at numbers, but we're setting specific goals or workplace culture checkpoints and what that looks like. So, for example, let's say that a part of your workplace culture is that you want to be able to change the dynamic around micromanaging, which tends to be heavy for type A perfectionist because it is super easy to be able to step into and just do it yourself or complain about it and then nothing ever changes.
And a lot of people mistake micromanaging for being a micromanager and leadership as the same thing.
Yes.
Go ahead. I'm sorry. I didn't mean to
No, I love that. No, I appreciate that. And so when we step into it, we have to give ourselves the opportunity to give our team and the individuals around us autonomy. Now that gets taught over time. So if you have individuals on your team who they've done things in the past and stuff has fallen through the cracks or they haven't stayed on top of stuff, it's really easy to step into the role and say, why didn't you do this? This is what you missed. Don't do it again. But that turns into micromanaging because you either take that on as the leader or you just automatically go into do this, do this, do this. You're not teaching them those problem solving and critical thinking skills. And that takes time. So when we're looking at something quantitatively and you're changing the dynamic and building out autonomy, give yourself a period of time, just like you would the production numbers. That means, let's say you're instilling something brand new and you're stepping into that teacher role because to build autonomy, you have to teach. So let's say for the next 3 months, you're going to be working with one of your members of the team and you're going to start to focus on specific results that could be they're making sure they have everything set up in your operatory, that things don't get lost. So there's a bit more thoroughness. So then you're not having to buy additional instruments because things all of a sudden grew legs and walked out or ended up in the garbage. So you have to step into. So when something happens, instead of automatically going into, oh my goodness, I can't believe that this person did it again, pull them aside and ask, hey, what's going on? How can I help? This is what I've noticed. And so when you start to open up that dialogue, it gives them the opportunity to be able to share with you what was going on. Maybe that's something and it completely slipped their mind, or maybe they didn't realize it was one of your expectations for them to do that. So when you start to have those dialogues and you start to implement something new, you have to give it time to be able to process, and you have to say it more than once because now it's a priority. We automatically assume, because of that type A personality, that, okay, if we say it once, people should be able to pick it up and they should automatically know. We have to repeat it. So let's say that timeline again is 3 months. On day 1, you have the meeting and you say, this is what you look for. 2 weeks later, you have to gauge how it evolves. That means you're tracking. That means you're not asking any more additional questions right now. You're giving them the opportunity to be able to explore. Then when the 2-week point comes, that's when you say, okay, have they shown me enough, or do I need to check back in and remind them that this is an important expectation for me? If that's the case, you let another 2 weeks go by. You start to expand it even more. And then at the 3-month mark, you would have documented enough, similar to having your numbers of a production. The only difference is that you have to be tracking it versus your software system that's tracking it.
Right.
So when you're then tracking it at the end of the 3 months, now it's not emotions that dictate whether or not you've had a good or bad day. You have the information to be able to then go back, sit down with the individual and say, listen, this is what has happened over the last 3 months. What's going on? We need to change. At this point, you have to make a decision on whether or not you continue to work with this individual because you do see that they are able to learn and that they are able to grow, or you have to make a decision that this is no longer working and take that next step of potentially letting someone go. But we keep getting stuck in that aspect of emotions, burnout. And so we rely on that at times to be able to show us what is going on in the clinic. But that doesn't actually show us because you could have had a really bad sleep. Maybe something personal is going on. Something sets it off and we can't actually evaluate what is in front of us. And so you have to take that time. And this is where it goes back to, well, it's not productive. I'm not doing a procedure, so it's a waste of time. And that's how we automatically think. But it is just as important to be able to look qualitatively to improve culture from a long-term perspective. It's not going to be where you take a continuing education course and you come back and you're like, oh, I can implement this root canal because now I have the equipment and I know exactly what I need to do. 3 sessions later, you're like, yeah, I got it. Okay, reduce your time, fits into your schedule, and away you go. No, developing relationships, building trust, teaching autonomy, critical thinking, and problem solving takes time. And that is what we don't give ourselves, is the time to be able to say, let's implement this, let's test it out, let's do checkpoints, and then let's reevaluate at the end of the period.
I love the fact that you can turn something subjective like that into something objective and qualitative. That is so, it's so true that so much of business ownership that I see, particularly among dentists, is that like, I feel like I'm doing a good job, or I feel like we're struggling in this area, but it could be related to, like you just said, a bad night's sleep. It could be a bad stretch in your personal relationship. It could be, something's happening at home with your kids. It could be just you're in a funk for whatever reason, and you're misinterpreting that feeling to something going either positive or negative in the dental practice. If you could turn that into a more objective measure, oh my gosh. Yeah, that no matter how it is that you do it, turn it into some sort of qualitative measure, you'll get so much more effective data from that. And then you can get into like being a more effective leader, growing the culture of the dental practice, etc. Oh, I love that. That's so good. That's so good. In the last, say 10, or do you have 10 more minutes?
Yeah. We're
talking forever here, but this is great. I mean, I could do this for another 2 hours, but I would love to kind of get into your book because just the title of it intrigues me. So it's Speak Kindly, You're Listening. And there's a lot of stuff that happens inside the mind of a type A perfectionist, and then maybe something negative that could be happening based on what's happening in our professional life or our personal life. That negative self-talk can affect a lot of different areas of our lives. But tell us, like from a high view, what the book is about, and maybe something implementable for us so that we can eliminate some of that negative self-talk.
Yeah, so the book is broken down into 4 parts: imposter syndrome, perfectionism, burnout, and then the last part that I call darkness. And I share my story, my client's story, the research behind it, and then I give actionable tools to be able to start to make those changes. So they are what I like to call brain training exercises. And the thing with mental training is we don't necessarily get to see the physical results like when we go to the gym. And let's say you're building your biceps or your quads over a period of time, you're going to start to see that physical change. So you're going to stand in the mirror and you're going to be like, whoa, this dress looks better on me, or I can see that definition. But unfortunately, when we're brain training, we don't necessarily see it until it's like months or even years later. And all of a sudden we sit back and we have a moment in time when we're like, whoa, I see the change now. So we underestimate what daily small amounts of us working on our self-talk actually does for us from the long term.
I see that with people that are getting into meditation, right? It's like, nothing is happening. I've been doing this for 3 months now. I don't feel that much different, and there's nothing measurable. So right. I'm tracking. I'm following you. I'm sorry. I didn't mean to.
No, I love that. That's a great example for it, because when we see meditation, we don't see those results until way later. And that could be silencing our mind while we're standing in the grocery store line, not realizing that the world is just hustling around us. And all of a sudden we're there. Like that's what meditation does for us. So our self-talk, there is an area in the brain that lights up when we're having a conversation with someone out loud. That same area of the brain lights up when we're having a conversation with ourselves too, which means we hear it just as loud. So you speaking to yourself with that negative words, those negative phrases that you use, it's as if someone is standing in front of you, having a conversation with you, telling you that you suck. But we don't interpret that, especially as a high achiever. We see it as a way of, oh, this is motivating me. It's going to keep me humble. It's going to like keep my head small so that I can walk through that door. But it's actually causing more harm than good. So that affects our mental health, our physical health, because if we're consistently tearing ourselves down, it's harder for us to be able to build ourselves up. So we have to give ourselves the opportunity to see what we are truly capable of. So the one thing that I like to do from brain training exercise, I do this with all of my leaders, is I get them to create a positive investment container. You can call it a brag box. You can call it whatever it could be something physical. It could be something digital. I actually have a wall. So every year I take everything off that wall, and then throughout the entire year, I collect stuff that I've achieved, I've accomplished. I write notes to myself about my capabilities, and it is that qualitative aspect of, okay, this is me. This is what I'm truly capable of. What you're doing is you're creating an alternative resume. For the longest time, our CVs and our resumes are, okay, where did you go to school? What have you done? And we look at only life-defining moments. And that is how we usually chalk up our success and happiness, is by buying that house, getting your first clinic, retiring. It's only those big moments. But what about everything else that happens in between? Mm-hmm. And so you get to be able to see you and talk about you in a different way. So that negative voice I like to call your inner gremlin. And it's been with you up until this point. My inner gremlin still pops out every once in a while. But the thing is that when you start to see it and start to see what it's saying to you, you can start to reframe. And so when you're reframing your words, you're starting to build a different voice. Someone who cheers you on, who inspires you, who knows that you are truly capable of doing all of the things. But in order to be able to believe what you're saying, that voice also needs proof. And so by you creating that brag box, the positive investment container, that's what you are doing. Why do I call it an investment container? Because you get to save it for that day you've had a really bad sleep or something has happened. Because what you're doing is you're drawing on an investment, just like money, on a rainy day. So tap into that box when you need it. So the way that I like to think of it, and this is where, going back to meditation, you have to practice. It's not all of a sudden on a day where your mind is racing, all of a sudden meditation is going to work for you. So I like to compare it to playing rugby. You're not going to show up to a rugby game all of a sudden expecting to win if you don't practice. Mm-hmm. So the investments that you're putting in to build your confidence are going to be there for game day, that rugby game, or that day that you had a really bad sleep. And that is what is so important, is that we have to give ourselves the opportunity to be able to say, the investment that I'm creating, even though it's not production numbers, even though I may not be able to see the quantitative aspect, it's there. This is me. This is who I am. And I can trust myself.
Yeah. Wow. That is powerful. So is this something that you have been able to integrate into your personal kind of lifestyle? And how do we develop this habit? Like when we catch ourselves, first of all, I guess awareness is the first step, right? It's like, holy cow, I'm now aware, because I'm paying attention, that I am speaking negatively to myself X number of times per day. It's the vast majority of my self-talk is negative. So once we're aware of that, what exactly do we do with that awareness?
Yeah.
Like,
so
stop it.
So I have an entire step process to be able to start to make that change. I think the biggest thing first and foremost is when you start to notice that voice and you start to hear it on a more regular basis, it's automatically, as that high achiever, we automatically go into, I can't believe I said that again. Why didn't I catch myself? Why didn't I stop myself? So we automatically go into that anger again. First and foremost, you're creating self-awareness. Maybe you didn't even realize that this was the voice that you had, or you noticed it comes up with certain procedures, or you're with certain people, or you're getting ready to do something new. You get to start to track, just like, let's say someone comes in with a toothache, you get to track exactly what bothers you, what sets off that inner gremlin moment. Then what you get to do is when you start to notice it, you start to reframe what you're actually saying to yourself. So something, I actually have a newsletter that I send out every Sunday. It's called the Sunday Slay. And I take you the real life examples that people share with me around what their inner gremlin is saying and how do we go about reframing them. So one of them that tends to come up quite often is I'm not good enough. And words have meaning and value. And so you have to test out when you do a reframe on what actually works for you first. So the I'm not good enough, you could switch it to I'm learning, I am good, I'm getting better, I'm improving. Whatever that looks like, you have to give yourself the opportunity to test out those different words. I don't like the word enough, especially when it comes to our worthiness. So people would say, oh, okay, well, I'll go from I'm not good enough to I am good enough. But when we hear the word enough, we can automatically assume we're still lacking something and we're not there yet.
Yeah. It's not ideal.
So it's not ideal.
Yeah.
So we get to test out those words. Now, how do you know if the words that you're saying, you're actually starting to believe? And so that's when we get to start to pay attention to our body. So our mind's connected to our body, and the words that we choose tend to elicit a response inside of us. When we are activating our inner gremlin, that tends to activate our flight or fight response. And so we get those negative sensations that tend to, or what we deem as negative, uncomfortable sensations that show up in our body. That could be butterflies, that could be increased heart rate, that could be starting to sweat, or a creeping sense of dread. It's different for everyone. I have someone who describes it as ants in their pants at times. So you get to tap in. What is your body saying when your inner gremlin is speaking to you? Then when you start to do the reframe, you get to start to pay attention to, okay, did that sensation start to drop off? If it didn't drop off and it didn't necessarily start to make you feel better, those sensations start to relax out, then you need to experiment with the words, because maybe you don't believe the words that you're using. So the way that you can think of it is kind of like the pain scale, but your belief scale. 0 meaning you don't believe what you're saying at all, to 10 meaning you absolutely believe. If you can get yourself from a 2 to a 2.5 to eventually a 3, and you're slowly starting to work your way there, then you're believing the words that you're saying because your body's also responding to it as well.
That's cool.
Yeah. So when we start to pay attention to our self-talk, it just doesn't affect how we just say something to. It affects our entire being, how we choose to show up in the world, how we present ourselves to our friends and family and our patients. And so if we can really pay attention to how we choose to speak to ourselves, we can slowly start to create a new voice, and one that cheers you on, inspires you, and gives you the opportunity to build self-compassion for yourself as well.
I want to read this book like today. Is it available on Audible, or is it just in print?
Not Audible yet. It is on Amazon that you can find it. Audible is actually going to be coming out in the next 3 months.
Oh, that's so good. Are you going to read it yourself, or are you going to have?
I am reading it myself, which I'm so excited about.
Tell me about that. How long will that take, do you think?
So I have it set up. I'm actually working. So for my podcast, I have a podcast producer, and so she's been setting it up. So that's why it'll be another 3 months. Okay. She's like, you can't cram this out all in 2 days. We need to spread this out.
Can you imagine, like, towards the end of like the last chapter, you're going to be like, your cadence will be off. You'll be exhausted. Yeah.
Yeah.
Your voice will be gone. Yeah.
So she's like, we have to do this over a period of time. So we're in actually the planning phases right now and booking out the studio. So then that way it's okay. And then I'm super excited because I share some very personal stories in there. And so when I had my book launch party, I shared one of those stories from the book and read it. And so people were really excited for the Audible version to come out. So thank you for being just as excited, because I'm thrilled for it.
Oh, that's how I consume most of my stuff. But I like to also buy a physical copy of the book. So I'll just buy your book now, and then I'll wait for it to come out on Audible, but I'll read it beforehand. Thank you so much for putting this out into the world. It's interesting because when we're talking to dental students and young docs, which is a good percentage of my podcast audience, because, they're more attracted to this type of media. Podcast listeners usually skew a little bit younger. But when you're talking to them, they kind of dismiss a lot of this type of subject area as, I'll never have to worry about that. Right now, I just got to hustle. Self-care and self-talk and burnout, all that stuff that's something that I'll worry about later. But I will tell you guys, as somebody that's been doing this for 20 plus years, it happens 100% of the time. So this is something that you need to start thinking about now, no matter where you are in your career trajectory. This is really, really the stuff that's going to pull us through difficult points in our career. And it's going to definitely give us a greater quality of time while we're actually practicing clinical dentistry. Every single person that practices clinical dentistry for any length of time will get burnt out, will be physically exhausted at some point, will be mentally and emotionally exhausted and tried at certain points in their career. So this is the stuff that we have to make sure that we're consuming. So really, really, I'm honestly so grateful that you've put this out into the world. So thank you so much, Jessica.
Thank you. Thanks for having me. I really appreciate it. Love these topics so much.
Oh, me too. I'm probably going to bug you to come back because I feel like I barely scratched the surface. I was like, oh, I want to talk more about this topic, but we're going to move on because there's something else I want to talk about. But can you tell us about where we can find your podcast and how we can find your book?
Yeah, so podcast is called Speak Kindly, You're Listening. Same thing as the book, so just keeping everything really easy with the same name. And you can check out all my social medias across pretty much every platform at Dr. Jessica Metcalfe.
Awesome. Well, Jessica, thank you so much for dazzling our audience and me. Selfishly, that was really, really necessary for me. And I'm sure that people are going to get a lot of value from it. So thanks for everything you do for our profession.
You're so welcome.
All right, ladies and gentlemen, Dr. Jessica Metcalfe.